long-term back pain after childbirth. Now, as an executive mom juggling your demanding job and motherhood, the last thing you want is a lingering pain from childbirth, whether this has been a few years ago or it has been a recent experience for you. Now, we are talking about back pain here. So, many women wonder if the epidural that they had been giving during their delivery or during their childbirth time has actually been the cause of their back pain, because we all hear about this and we sometimes wonder if what happened. With the epidural at that time during the childbirth or delivery, did that really affect my back, and is that the really the cause of my back pain? So if you are one of those who has wondered about this, maybe this is a video you want to watch. And before we get into the topic for today, let me introduce myself for those of you who don't know me. My name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain. I do this by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain journey and my adrenal fatigue journey. By adrenal fatigue, I mean low energy levels and lack of focus, or mommy brain, or brain fog, as it's sometimes called. When you have these conditions like low energy levels and lack of focus, it is not easy to manage your pain, or rather to even manage your everyday life. And I have been there, done that, and that is what I guide you or help you to do. That is basically get into a good position to manage your spinal, that is back and neck pain, despite low energy levels and brain fog. All right, so I'll not take up more of your time because I know we are moms, we're busy people. So let's get into the topic for today, that is, can an epidural cause long-term back pain after childbirth? Now, epidural anesthesia is something that is commonly used during labor to relieve your pain, and it is typically injected into the lower back near the spine, so basically into your lumbar spine. So, for many moms, it provides that essential relief that you need during your birthing experience, and it makes it more manageable. However, some women, they report that they have back pain after receiving the epidural, and it leads to whether this injection might be the cause for this back pain. Now, while epidural itself is generally considered safe and doesn't directly cause long-term back pain, there are a few reasons why you can have back pain after childbirth. So you could have temporary soreness at that injection site. It is common, and because of course you've had a needle inserted there, right? So it is quite mild and it subsides after a couple of days or a week or so. Now, another thing is you have some pregnancy related changes that happen in the body, which could be the cause of your back pain. Now, I'm not saying that the epidural does not cause back pain. Of course, it can, but these are some things that can be in the background, and the epidural can either add on to it, or maybe they are the cause of your back pain. So, it is a question to ponder about, right? So, did you have pregnancy related back pain? So these changes that we're talking about could be physical changes, like you change in posture, because of course you're carrying a heavier weight with your pregnant belly in the front of you. So there's a lot of strain on your lower back, and of course there's a change in your posture. Now, there is also a loosening of the ligament because of the relaxin hormone that's secreted, because you want your pelvis to expand with the growing baby. You want that expansion of the pelvis to, to accommodate the baby, and the um, expansion that happens, the relaxin being secreted is a part of that whole, physiological changes. I'm not going to go into the details of that. Now, just looking at my notes here, I lost my chain of thought. So, loosening of the ligaments due to those hormone shifts. Now, these changes often contribute to your postpartum back pain, regardless of whether you've had that epidural injection or not. So, another thing is the strain on your back during that labor and delivery, right? Now, it can be a very physical experience, and it is for most women. And combined with the strain on your lower back, the pushing, the pelvic area being, obviously, there's a lot of disruption and there's a lot of disturbance in the pelvic area. This can sometimes lead to a lot of back issues, especially around your sacroiliac joints. Those are the joints that join the lower part of your spine to your pelvis. So that is basically the joint that present in between your pelvis and your spine. So there can be a lot of pain and discomfort around your SI joints as well as your lumbar spine because of the labor and delivery strain. And in our mind, we think of that as the back pain. You don't know whether the epidural has actually contributed to it, or this was a standalone factor for you. All right. So another thing is during your pregnancy and even after, many women experience weakened abdominal and pelvic floor muscles, especially if you've had a C-section, right? So maybe you went in. For a natural delivery or a C-section, but there is a lot of weakness around your lower abdominal area. There's a lot of weakness, as you must have heard about diastasis recti, where there's a separation of that muscle, of the rectus muscle. But again, not getting into the details of that, but there is a lot of weakness in your core muscles, in your pelvic floor as well. That itself, when your pelvic floor is weakened, that itself can lead to a lot of back pain. The relation between these two, I would like to highlight it, is when you have a weak pelvic floor, your pelvic floor is a part of your core musculature that supports your lower back. If you are more interested in knowing more, I've done a couple of YouTube videos that talk more about the core muscles, because usually people think of the six pack abdominal muscles as your core, but that's not true. Core muscles are the deepest muscles in the body. So these are the ones immediately next to your spine, and they are supporting your spine. These are the ones that stabilize your spine while you're doing movements. So if I'm moving my arm out like this, the core muscles are stabilizing my spine, while the movement muscles are the bigger global muscles are the ones that are doing this motion for me. So there is a difference. The core muscles are very important. You can go to YouTube and type my name, Swati Prakash Core, and those muscles will come, sorry, those videos will come up for you. Sorry. And or you can just go to my YouTube channel and have a look there. So we were talking about core instability and muscle weakness. So because of that, you can have back pain issues as well. Now, um, of course, if you have more soreness and you have pain, numbness, or tingling that's radiating down your legs, you definitely want to get that sorted if you've had that right after your epidural. We're not talking about years ago, but if you've had a recent childbirth experience where you still have that soreness, pain, or tingling, numbness, go to your doctor, have it checked out. All right. So just looking at my notes. Yeah. So what I've done is I have written a blog with more details on this topic. And in that blog, I have included a video that talks about 4 easy tips to manage your postpartum back pain, which is back pain after childbirth. And that video gives you a lot of details. And also, I have left a free guide for you. This is called Quick Office Stretches for Back Pain Relief. I initially made it for working moms, but this is something that you can do if you even if you are at home, you're working from home. Of course, if you've just had a C-section or you've just had a little delivery, go with caution for these exercises. Have a look at them and only do it if your doctor has given you the clearance after C-section, or that is a cesarean, or if you are comfortable doing it after your natural delivery. If you're not sure, contact me and I can help you out with that. Alrighty, so basically, this was the main things these were the main things that I wanted to talk about with epidural injections. So yes, epidurals can cause long-term back pains, but there are also other things to consider that we just spoke about if you have postpartum or back pain after childbirth. So I hope this was useful for you. If you have any questions, any comments on today's video, do let me know and I'll be happy to help you out. Alrighty, I'll see you guys next time. Bye for now.